Welcome to the Natural Doctors. In this episode, we're going to be talking about a fringe, or what used to be a fringe internet diagnosis, leaky gut, and now is no longer fringe. This is the subject of major scientific study in many labs, top researchers around the world, and now recognized as a contributing factor to many different chronic diseases, everything from cardiovascular disease to autoimmune disease to neuroinflammatory disorders. So we're talking about gut barrier issues and what can come up around clinical management and conditions associated with this. So in this episode, we're going to take, a clinical perspective. Dr. Katie Dinello and I are going to talk about what we've been seeing in the clinic, and then stay tuned because at the end, we're going to cover your questions. So let's start talking about what we're seeing in clinic that is related to this and how do we assess this? We're going to, get into all the details.
Yep.
And
Definitely.
from my perspective, right, like I've been doing this for 20 plus years. And when we started out, and I'm like, even, still, I think in conventional medicine, it's leaky gut intestinal permeability is still causes eye rolls,
Yep.
right? Like, what is that?
Yeah.
This is not a diagnosis.
It's so true.
Right?
And it's so frustrating because there is so much research and science on this. So any doctor who is telling you this is not reputable, they're not up to date by any means.
Yeah, because you can look in any leading medical journal and find this on everything, right? Rheumatoid arthritis,
cardiovascular
heart
disease,
calcification, everything.
Oh yeah, totally. So somewhere like what I have been seeing lately in terms of leaky gut is that autoimmune connection for me. So when I have a patient coming in with an autoimmune condition or even a borderline autoimmune condition, so maybe that ANA is elevated, but they went to rheumatology and rheumatology was like, you don't really fit any category, but something's going on.
Right, so then that's like immune mediated, right?
Exactly, yep. And so my first instinct there is, okay, we got to figure out what's going on in your gut because your gut is that interface between the outside environment and what's happening in your immune system, right? Food, environmental particles, whatever's in your gut, right? It passes through that gut barrier and the first thing it interacts with is your immune system, right? And then that sets off inflammation. So that's the connection between all of these systemic diseases like autoimmune, cardiovascular, and leaky gut.
Have we talked about inflammation on this show before?
Never. We have no episodes on inflammation.
But this is, and so we've dropped this, in other episodes where we say, okay, leaky gut permeability, right? This is, and we've talked about LPS.
Yes.
That component of bacteria that comes through and the immune system recognizes it. But it's not something, so when we think about diagnostic wise and symptom profiles, this is where it's challenging, right? Because this is something that people can have and they don't have any symptoms. So we're talking about leaky gut. It's in your, in your gut, and people can literally have no symptoms. Like they don't have bloating, they don't have changes in their stools or anything. And they can still have barrier issues, right? Permeability issues.
Yeah, totally. When I first started out in clinical practice, I used to think, okay, they're having a bowel movement every day. It's easy to pass, complete, no blood, no mucus, no bloating, no reflux. Like, we're good. We don't need to work on the gut. But now we know that's just not the case because, we've been doing this for a while now. We've tested a lot of guts, even in people who are seemingly healthy and having great bowel movements, and their gut is still a mess, right? You know, for lack of a better term, because that testing, you know, reveals as such.
Right.
But you're right, that testing can be really, really tricky with leaky gut in terms of what's validated. And it's not even just what's validated. Like, we have a lot of markers that are validated, but they can be tricky outside of a research setting to actually perform on patients. So that part is a little bit tricky.
So there is some challenges. There are some challenges there. So, I mean, in, you know, real world clinical management, we're looking at, okay, symptom profiles and sort of, you know, people's propensity, the likelihood that they would have leaky gut. And then we run some testing. We've got some actual markers here, and this picture is all lining up together, and they maybe have microbiome disturbances layered on top of that. But, you know, what patients, so like, let's think about from a patient perspective, like for people, viewers that are out there and they're like, oh, do I have this? What are some red flags that kind of go off for you where you're like, I might need to do gut barrier testing here on this patient?
So for me, like I said, definitely all my autoimmune patients are getting full treatment. Patients with a lot of food sensitivities. So different than our last episode, SIBO, that we were talking about. But maybe we do food sensitivity testing because patients come in wanting that all the time. And so many foods are highlighted. And it's not that they're truly sensitive to all those foods. It's that they've developed an immune response to them because of the leaky gut picture. So that's what I'm seeing. Or patients who just, they don't feel good when they eat dairy, gluten, soy, corn, you know, the list goes on. Like, they're having to really take themselves off a lot of foods. Those are two, you know, big things for sure. Other things, you know, we talked about this briefly in our SIBO episode, anxiety and depression, right? There's really strong correlations there. And then, of course, we can't forget about the cardiovascular picture. At this point, any patient who has cardiovascular disease, I'm also honing in on their gut because those are connected, as we know. And we've done cardiovascular episodes, so look back in our archives here. We've got loads of information on this. But yeah, so if someone's coming in, when we think about cardiovascular disease, we know that there is evidence of leaky gut or increased permeability in patients that have high blood pressure, right? So we start to single out some of these conditions. High blood pressure, which is something you would commonly see in clinic. And then also calcified plaque in the artery. So like known established atherosclerosis, right? Where people are getting calcium scans and we know there's actual like plaque that's sort of set up there. And then, I mean, more advanced, certainly, and we're usually not dealing with this in a clinical setting, is like heart failure, things like that. But I would say those are two. Then there's some other cardiovascular conditions, but those are the two big ones. So like, agreed.
I would definitely think about that in those two cases, right?
Definitely. Any other patients that you're typically thinking of that come in with leaky gut, like what they look like? Right.
And so I would say then, like, I guess like the gut patient, right? We kind of forget, even though
we forget the obvious, right?
Asymptomatic, then we've got the gut patient. So patients that have inflammatory bowel disease. This is because we're clinicians and we're like that just seems too obvious to us. And we're like, well, okay, but inflammatory bowel disease, so Crohn's, colitis, irritable bowel syndrome, right? For sure there. And then certainly like vague digestive complaints, and then like SIBO, actually.
Oh, definitely.
If you have SIBO, then that can cause a leaky barrier. Patients who have celiac disease, but once the celiac disease is managed and in remission with a gluten-free diet, then those that barrier corrects.
It does.
But that doesn't mean that you still can't have it. So if you had intestinal permeability or increased permeability from celiac disease, it doesn't mean then you're safe forever.
Right, exactly. There could be other triggers.
That could get established.
And this is a little bit of an offshoot here, but what's interesting, and we have research that shows this, is people who are on a gluten-free diet are often less healthy because gluten-free products have a lot of extra preservatives, right? And they become
a lot of junk in there.
Yes, they become more processed. And so that's a big deal, right? And so I always warn my patients who are gluten-free or celiac, I'm like, don't just eat these gluten-free products. Like, you got to eat real whole foods. So tricky. Got to watch out for that.
And it does. It affects like your microbial diversity. We like to talk about that. So how many different types of good bacteria you have in your gut. There's large scale studies that look at this, and it's just like they just take gluten-free diets as a class. And we're not dissing gluten-free diets, because gluten actually is a big trigger in glyphosate of intestinal permeability and microbiome disturbances. Huge. But just emphasizing what you said is that a lot of times people go on gluten-free diets and they're eating the like gluten-free alternatives versus just like eat real food that is not containing gluten.
Yeah, exactly. And you're right. Like, we need to emphasize that even if you don't have celiac disease, you can still have a gluten sensitivity that is contributing to leaky gut.
Yeah.
So,
and that's a big thing, especially for any patient who has autoimmune disease, that we will recommend, okay, you've got to get off gluten, because we know there's this interaction at the cellular level, like down to these tight junctions that sit into the wall of the bowel, those cells, that gluten is interacting with those. Right.
Yeah. Especially if you have Hashimoto's too, right? Autoimmune thyroid disease. Yeah. All right. Agreed. I love all of that.
So do we talk about testing a little bit here? Maybe
let's talk about what the testing options are.
Right. Because it used to be that you fill out a question. This is where it was like this fringed internet diagnosis. Yeah. So back in the day, people would come in and they'd filled out a questionnaire online and said, I've got leaky gut, right? And then, you know, there was not really great ways to test. Yeah. But one test that has been around for quite some time and is probably one, you know, of the most validated tests is a urine-based test, this lactulose mannitol test, which also checks for malabsorption. But that's a relatively inexpensive test, not very invasive. You're just drinking a solution and then, you know, doing a pre-urine sample and then collecting your urine after you drink it, and then checking to see if you you know, what's collected in the urine.
Right. What's going on there. That gives us insight. You know, when you're reading research papers on this topic too, they're all using that lactulose mannitol test as well. And so, you know, important to know about. Zonulin. Let's talk about zonulin. Zonulin is a marker that we can measure in the blood or the stool. I would say I am more commonly testing it in stool than blood. Same for you. Yeah.
Except when we do zonulin antibodies. So so if you're just checking straight up zonulin, like you said, you can do that in the stool. But if you need to check an antibody, which commonly we're doing this gut barrier panel, that's just a little finger stick, and getting a couple of different markers, looking at zonulin and LPS and occludin, but also checking even for candida on there. So it's a quick, like, easy collection. Certainly, you know, it you know, requires a blood sample, so some patients can be a little queasy about that. But you know, it's inexpensive, so it's easy to do.
Yeah, exactly. And so zonulin is a protein that helps regulate how tightly those cells stay together in our gut, because when we have increased intestinal permeability, those cells separate a little bit, and it allows, you know, antigens, food particles to pass through. They get exposed to our immune system. And so those zonulin levels are higher, right, if we have more leaky gut. So you can measure zonulin directly, or like you said, these antibody levels, which is measuring the immune system's reaction to the zonulin.
So sometimes when patients are getting those big comprehensive functional stool tests, like something from Vibrant, then
GI map is another one.
Going to see, you could see zonulin as a marker on there. So if any of you have had testing done like that, you can go look at your results and see what the zonulin level looked like.
And then we have also on previous episodes talked about LPS, lipopolysaccharide. Like you just said, we're really not directly testing LPS usually, but that antibody in that finger stick is a really great way. Briefly, LPS is a toxin toxin, that certain bacteria release that can cause havoc on our gut, and then of course contribute to leaky gut. So that's another test as well.
Yeah. So those are probably the biggest ones,
I would say so.
right?
Yeah.
So those are the main ones.
Yep.
And then we would address, what's causing this. Like, of course, we need to get into what do we do about this in the first place.
Yeah.
But then we would retest. So once we go through initial diagnosis and then go through management, then at some point we would want to retest. But this is not like you're getting retested in 2 weeks situation, right?
No, it takes time. So why don't we talk about what are some major causes of leaky gut that you tend to see in your patients?
Yeah, so I would say the biggest cause is just our environment, when I include all the chemicals we're exposed to, and again, the processed food. That's a huge piece of it. And then and the reason why that's happening is then it's affecting different like layers of the gut barrier. So it's affecting the microbiome that's so important. And so that can also be affected by medications, taking antibiotics, taking NSAIDs, taking these antacids, so many different medicines can affect that.
It's so true.
I think when I looked at this at one point, I think there were 41 classes of medications that could affect the gut barrier. So that's a big piece of it. So chemicals, medicines, those are big parts of it. Stress
is
I think is
one.
a huge one. The stress and anxiety that keeps coming up over and over again.
Yeah. Again, highlights that gut-brain axis connection and how important that is. Back to what you're saying about toxins, medications, we kind of refer to that as our allostatic load or our total toxin burden. And that's a concept I am explaining to patients all the time of like, it might not just be gluten or dairy. It might be small amounts of a lot of different things, and that's why we really need to work on eating organic, cleaning our fruits and vegetables, reducing our, chemical toxin exposure, makeup, skin, like all of it, right?
And even natural foods. Like you start looking at the ingredients in some of these packaged foods and alternative milks, and they're full of emulsifiers. There's so many different things. So you still have to really be a conscious shopper.
It's
Do
true.
your homework and really, the closer you can eat to just like how it comes out of the earth, that's the best option.
Exactly. Yeah. And this, I need to, take us off on a tangent for a second because I have gotten this question multiple times in clinic this week. And I will say it's my younger female patients, early 20s, they're on TikTok, right? And we're on TikTok too. We're cool. But there's a trend.
We think we're cool.
We think we're cool.
Our kids don't think we're cool.
No, not at all.
Yeah.
My 4-year-old already thinks I'm not cool.
I think you're cool still. Wait till they get a little older.
But is eating and drinking baking soda. And so many of my patients are like, I started doing this because, it's all over TikTok. And I think this has gotten a little misconstrued. So back to what you were saying about like buying organic, right? Whole foods. Baking soda is fine to use to wash your vegetables in. I tell my patients, baking soda, a little white vinegar. We actually have research that baking soda does bind glyphosate and other toxins. So yes. Do we have research that baking soda removes it from our bodies? No. So please don't.
So this is like kind of like I'm going to get off on a tangent. What about the Jello trend?
Oh my gosh. This was
like your fat is going to melt away.
This was crazy. And I'm going to take us on another tangent. Who here watches Real Housewives? Because Kathy Hilton brought this up
I saw
on
this.
Real Housewives. I also had multiple patients ask me about this.
I've gotten this brought to my attention.
And she was like, I started doing the Jello diet. Oh my gosh. It turns out it was totally AI generated.
Like, what is in this Jello?
Random stuff.
Like, I don't know. Like, it's Jello with other stuff and it melts your fat,
It's supposed to melt your fat. And guys,
sounds
come on.
reliable.
If it sounds too good to be true, it is. Do not fall for this stuff. Oh my gosh, so funny.
Back to leaky gut.
Okay.
This stuff's way more funny, but
So other things that can cause it are these chronic infections like SIBO, H. pylori, or just this term dysbiosis that we talk about, which is that imbalance in those good and bad bacteria.
So this is all tied together, right? This is not all these separate factors. This is still like your living gut. There's a lot going on in there.
Yep. Yeah. And then we can't forget alcohol either, right?
Yes,
a
big
huge
one.
toxin. People are drinking way too much alcohol.
Yeah. And
Stop
clearly that has been shown to increase intestinal permeability. Another thing is that public speaking has been shown to increase intestinal permeability like quickly. Like they've measured this. And so just talking in front of a group. Now, some people, right, this is worse than death to people.
Yes.
I guess not to us, but
yeah, we're fine with it.
Clearly, I think our guts are probably okay because we keep doing this over and over again. But that just shows how stress and anxiety, how much it can affect you and like quickly, right? Yeah. So if that's just going on all the time, it really is a big factor in gut health and permeability.
You got it.
Yeah.
All right. We are going to move into clinical or patient questions, social media questions that we get.
Right.
And probably the number one thing is, okay, I think I have leaky gut. My doctor, oh my gosh, excuse me. Sorry, guys. Hold on.
Okay, let me find the questions. Okay. Will leaky gut heal on its own?
Exactly.
This one. Okay, so
will it heal on its own?
This is a common question. And so I would like, if I got this question, which I haven't, so this one might have been for like, came into you. But yeah, is it just going to go away? I mean, if you actually could identify the root cause of it, then potentially yes.
Yeah.
Right?
So it depends, right? Like if you start making changes through nutrition, like absolutely nutrition alone and reducing your total toxin burden, it can go away.
Right. So
definitely.
if you like gluten is a trigger, the glyphosate that's in gluten, and like eating all these added ingredients in food, if that's what is actually causing the leaky gut, then you remove the cause and then you're good.
Yeah, exactly. But if you do nothing, no, your body is likely not just going to handle this on its own. It's going to continuously be in damage control because remember, we're continuing to get those toxins in our gut every day.
Yeah.
So you got to do something.
Yeah. And the other thing I would say, kind of like a spin-off from that question, is if I just take this supplement, because there are leaky gut supplements and there's really good formulas that we use. If I take that and keep up with like eating whatever I want, will this get better? And no. Like this is the same thing we say about supplements all the time, like supplement to your diet and lifestyle, and you can't out supplement a poor diet and lifestyle.
Yep, exactly.
Yeah.
And when we have patients who are making all of those foundational lifestyle changes, absolutely we'll add on that supplement to really help.
It speeds up the healing time.
It really does.
Right?
It does.
Clinically, we see that all the time.
All right. I love this question. I actually talk about this a lot because I also do a lot with athletic performance in patients, and can overtraining cause leaky gut? And unfortunately, it really can. We do know, and we use exercise as a way to induce leaky gut in the research world. So overtraining, absolutely. We really see it in endurance races. So your marathons, your triathlons, that's when we tend to see it most.
Yeah.
We do see those rates decrease once the event is over, or we scale back on training a little bit. But if you are out there training, running marathons, you really want to make sure you're taking care of your gut. That's important.
Right. So what I'm hearing is that, yes, like there's this transient effect, right? So if it was more sort of isolated training episodes, then that could potentially just revert back.
Right.
But if this is someone that is really, overtraining on a regular basis, and certainly if you're running a marathon, you're going to be training leading up to that marathon. You're just not going to just go out and run it.
Yep, exactly.
I mean, maybe some people do that.
Yep. And then another question, is leaky gut the same thing as IBS or irritable bowel syndrome? What do you think about that?
Yeah. No, it's not. That's a simple answer here. Are we out of time? Okay,
let's go. We're done.
So IBS is like has diagnostic criteria. And so it is an actual different diagnosis than leaky gut or increased intestinal permeability. But as we mentioned, IBS could come with leaky gut, right? Like these two can coexist, I would say,
yes.
for sure.
And leaky gut may be a cause of that IBS diagnosis, just like SIBO is often a main cause of IBS. It's just the practitioner who's diagnosing the IBS might not know that SIBO exists as a root cause. So yeah, absolutely. Okay. And then what are a couple of your favorite treatments for leaky gut, or where are you starting typically?
Yeah, I mean, one of my favorite things that's pretty easy to do is Akkermansia. So this like pasteurized version of Akkermansia, it's a what's considered a postbiotic because it's a bacteria, but it's been pasteurized, so heat killed basically at a low heat level. And that has been clinically studied and can help improve the markers of permeability. So that's like simple. And we also know it has these other well-established benefits for blood sugar regulation, for obesity. So we see a lot of these conditions often overlapping anyway. So that's a nice one.
Definitely.
And then I'll often use basically a combination powdered product because there's a lot, you really need high levels of many of these ingredients to get healing. But some of the top ingredients in the powder that our favorite powder, the powder that we use, has glutamine. It has a big one is zinc carnosine in there, and then things like aloe. There are a number of different other ingredients.
Yep, definitely. These combo products do great. For me, and for you too as well, right? Also really honing in on that diet piece.
Yes.
And I will usually put patients on an elimination diet of some sort. If they can't do a full out elimination diet for about 4 to 6 weeks, because that's asking a lot of people. I get it. We will start by, we start with gluten, or we start with dairy or soy or whatever we feel like is most triggering.
Most that could be for them. And then we all of us in the clinic often run this whole like more comprehensive panel that has the gut barrier, this finger stick test that has the gut barrier test, and then has food intolerance testing on there too. So that's a way that we could really like hone in and see which foods are creating inflammation in the gut.
Right.
And that's really great, in terms of for patient compliance to actually see like, oh, these foods are probably like triggering the gut barrier issue, right?
Exactly. Yeah. All right. I think we did it. That's a solid episode.
Yes.
Thank you all so much for joining tonight in our discussion about leaky gut. We hope you loved it. Make sure you subscribe to our YouTube channel because we drop episodes every week, plus a lot of fun shorts and other videos up there as well. We're also on Instagram and TikTok like the cool kids. So make sure you subscribe so you never miss an episode. Thanks so much.
Adoption is a journey, and in any parenting journey, there are difficult things and there are really great things.
We did our training through DCF and we felt really well trained and well prepared. The social workers become like family.
We love them. They made such a huge impact in our lives. We have gotten so much support and so much love through DCF. You're never prepared for parenthood, but we felt as prepared as we could be. It's a joy that we hope others share as well. If you think that you are ready to foster or adopt, please go to ctfosters.com.
What are you doing this summer? Do you want to belong to a community that embraces the creative spirit, not pushes it aside? Are you ready to explore your inner passions and meet lifelong friends? YPI is for you. Since 1981, YPI has served as an annual retreat, a home base, and a welcoming environment for the curious mind. You'll find an inclusive, sharing community where we are always learning. At YPI, your success begins with believing there are no can'ts and no won'ts. We're not your average arts camp. You don't need any special ability or talent because our professional staff will foster your interest in the creative arts at any level. Maybe it's a paintbrush, or a microphone, a camera, or a pen, or any combination of all of these. We inspire passion, build confidence, and strengthen friendships. We're YPI. Are you ready to find out what the YPI state of mind is all about?